an average of 20 veterans per day die from suicide. So suicide can kill more people than were killed in the wars themselves. The potential advantages of using TM for PTSD are it appears to help the associated depression, it appears to be as effective as existing therapies, it's less expensive than other treatments.
There is growing research evidence that transcendental meditation, TM, is an effective treatment for post-traumatic stress disorder. For example, a recent phase 2 randomized controlled trial on 203 veterans with documented PTSD at the San Diego VA found that practice of transcendental meditation had a significant effect in reducing PTSD symptoms and depression and increasing overall quality of life. This study was funded by a Department of Defense U.S. Army medical research grant and published in The Lancet Psychiatry in 2018.
In 2008, I was hired to be the founder and director of the Traumatic Brain Injury Clinic at the Eisenhower Army Medical Center at Fort Gordon in Augusta, Georgia. What we found was that at 1 month, 83% of the TM group stabilized, decreased, or ceased medications, 11% increased medication dosage, compared to 59% of the controls and 40% that increased medication dosage. The other thing that we monitored was the severity of the symptoms, and there was a 20.5% difference between groups in severity of psychological symptoms after 6 months.
We saw significant reductions in PTSD severity, depression symptoms, anxiety, and insomnia. When we looked at actual status of having a diagnosis of PTSD, the Transcendental Meditation group had a 50% reduction of the PTSD diagnosis.
They get pretty much results instantly, with of course none of the side effects associated with the use of psychotropic medications. So we really feel that TM has proven itself in our, at Fort Gordon, to be a viable adjunct treatment modality in the military treatment for reducing post-traumatic stress and anxiety, and also reducing the physical symptoms.
It is now time to focus large-scale research efforts to assess TM's effectiveness to prevent the development of suicidal ideation and to treat individuals with suicidal ideation, so that TM can be added to the armamentarium of suicide prevention and intervention strategies.